Hello YouTube. So today we're going to go over thoracic diagnosis along with thoracic muscle energy. If you want to come and look at our spine here, so remember thoracic spine, you got T1 down to T12, 1 to 12, okay? And the way we diagnose the thoracic spine is palpating for both rotation and side bending on a segmental level. So we can start, working our way up. If you're testing rotation, you're going to be pushing down or really posterior to anterior, okay? So we're testing, if you can push better or more easily on the right, they're rotated to the left. If you're hitting a restriction or your left thumb is a little bit closer to you, that means, again, that this vertebrae is rotated to that left side. So you kind of work your way down, you push, push, push. Now if you want to check side bending, you have to come just off the transverse processes and translate. So if we translate to the left, that means we're side bending to the right. And if we translate to the right, that means we're side bending to the left. So again, you're really either pushing right on the transverse processes to check for rotation, or you're going lateral to them and translating to find side bending. Generally, I find students, when they're doing the translation, they don't have enough pressure going down to actually get on the ends of the transverse processes. So that's just something you want to be careful of. When you're finding the transverse processes, it's generally about a thumb's width away from the spinous process. So again, you find the spinous process, put your thumb down, and just outside of it, you're going to find that transverse process. All right? So that's how we do it on the skeleton. Now let's come over to Nick over here. Say hi to the camera. Say hi, YouTube.
Hi, YouTube.
So when we're looking at thoracic spine here, so for example, if I find, let's say, T1 is right here, and then I am putting my thumbs right on the the transverse processes of the thoracic spine, I'm going to translate away from me. Or not translate, rather, just push away from me. And if you come really close, you can see that same amount of pressure, but my right thumb is closer to me than my left thumb. The left thumb is deeper. Therefore, he's more rotated to the right, all right? Now, when the patient is seated, you can do a springing motion while keeping both fingers on that thoracic spine segment that we're testing. I'll put one finger just below, on the segment below, and I'll just spring down to capture motion right at that level. And my thumb is angled towards that vertebrae, okay? So that's his left springing, and then we check his springing on the right, which is not quite as good. Doesn't like to spring quite as much, and then we spring down. So what that means is, at this level, and the one below it, and the one below that, and we keep going down, in this region, from like T1 down to 4, let's say, he is rotated right and side bent left because of that testing. And that confirms he has a type 1 or a grouped curve that is T1 to 4, neutral, side bent left, rotated right, okay? So again, you can test that side bending from the edges of the transverse process like I mentioned, but I prefer that to be prone. So if you want to lie prone, and we can move your stuff over here, pop this out, and I'll start drawing a little bit so you can come on close here. So again, like I mentioned, right, we have your spinous processes. So I'm palpating, this is the vertebral prominens, which is C7, and then if we come to T1, so T1, T2, T3, T4, okay? Spine of the scapula ends here, comes across towards T3. So these are your spinous processes. If you put your thumb down, okay, and then you mark where the transverse processes are, which is pretty much going to be right there. So we can mark those. So when you're pressing to check rotation, that is the landmark you're pressing down on. When you're trying to test side bending, you're coming just off of the edges of those transverse processes. So you're kind of pressing up against these edges here that are in green. Okay, so what does that look like? Well, checking rotation, pushing down, checking side bending, pushing, with more pressure in, pushing, translating left, translating right. Okay, so that's checking side bending and rotation with the patient prone. All right, so now let's have you sit on up facing the window. Actually, you know what, let's have you sit on up, legs over this side. So when we do thoracic muscle energy, I prefer to have the patient sitting with the legs off of the side of the table because you can choose your side more easily, right? So if he was sitting with his legs over this side, it might be a little harder to maneuver because the table's kind of blocking you if you're trying to stand right here. So if he was rotated right, I'm going to exaggerate it, side bent left, we want to stand opposite the side of that rotation for a type 1 muscle energy. And this is going to be on page 274 in Nicholas, okay? So for a type 1, since it's like 1 to 4, we're going to treat in the middle of that group. So I would say around T2 over T3 would be fine. So we want to monitor always, right? So I'm going to monitor on those transition processes here. And what he's going to do is he's going to cross his arms, cross like this, okay? If you want to come over to the front, you can see. So as I'm monitoring here, all right, for type 1 dysfunctions, remember, wonder. 1, you go under that first arm and over the second. And what that does is if I'm standing opposite the side of rotation, all I got to do is pull towards me. And that's going to rotate him left and side bend him right. So that's already correcting or setting him up into that barrier according to his diagnosis. Because remember, it was rotated right and side bent left, okay? So what we have the patient do is, as I fine tune to that barrier, and you can come back around and look, you know, it's not a ton of motion because if I do this, I'm treating down to here, right? If we're treating up high, okay, you know, we're gonna be using just a little bit of motion to capture a higher level in the thoracic spine. So what we do is I set him up and then I tap his arm and just say, slowly turn to the right against me. 3, 2, 1, and relax. And then we reset a barrier, rotation right, or sorry, left, side bending right, turn to the right. 3, 2, and relax. Remember, this is PIR, so he's contracting into his diagnosis. One last one, turn to the right. And relax. And then we do just one final stretch and back to neutral, okay? And then we always retest, so arms down to your side. And he is moving better and more symmetrically. Less hypertonicity in the paraspinal tissue here. So that's how you do a type 1 muscle energy treatment for the thoracic spine. Stand on the opposite side of rotation. One arm goes under the first, your arm goes under the first and over the second, and you just pull towards you, making sure you're staying at the level you're supposed to, okay? So for the next one, we're gonna do a extension dysfunction or a type 2 dysfunction, okay? Now you can do this from, I would say, like mid or upper thoracics down to T12. And because it's extended, you're going to be having the patient flex forward for these. So let's go with the book on page 276, that he's got a T8 extended, side bent right, rotated right. So remember, for type 2 dysfunctions, they're isolated to typically just one vertebrae because it's traumatic and it's non-physiologic. So he could be coming in, you know, having had a car accident, and he feels like this catching or this restriction in his mid-back hurts when he takes a deep breath. And we find that this vertebrae is extended, side bent right, rotated right. Now, what might that look like? Well, I can have you lie prone real quick so I can show the camera and the people on the YouTube. So if we come to T8, so remember T7 is the inferior angle of the scapula, T7, T8 is going to be here. Now, if he's rotated right, you know, my right thumb is going to be more prominent, my left thumb is going to be deep, and then I want to check some side bending. So if I come out and translate, and I find that his left side bending is easier, And he doesn't actually have this, so it might be hard to see on the camera, but that would mean, if he's right side bending and he's rotated right, that means this thumb translating left should also have an ease to it, as opposed to this right translation or side bending right. And then I would confirm that by having him go up into a Sphinx position. So prop up your chin with your hands and put your hips on the table. Just relax them, relax them, relax. And then arch your back a little more. There. So that's extension, okay? And you can look up even a little more, okay? You can come to the side. So if this segment is extended and I check and it's more symmetrical, that means that is his ease of positioning. So rotation right is even, and then side bending right is even. And then if you tuck your chin and arch your back, and he goes into flexion a little bit, and I recheck there, and it's worse, and it's more asymmetrical, that means that that's his barrier, or he doesn't prefer flexion. So he's extended, side bent right, and rotated right at T8. All right, let's get into treatment position, so you can have a seat again. Okay, so what does that mean for our treatment, okay? So if he is, I'm gonna bring the book over here. So again, if he is rotated and side bent right, I'm standing opposite the side of rotation, okay? So that's step one. He's gonna do the same thing. Give yourself a hug, arms across. The difference is my arms, if you wanna come to the front, go over top of his arms, okay? And we can actually bring them flush to your body, like so. And then he can drop his head. So that's flexing, if you wanna look behind, down to this level at T8, okay? So that's already doing the work of flexion. Then all I do is I rotate him left and I side bend him left. Now how do I do that? I use my arms over his arms. So you can come to the front and see that. So if we start neutral, he's flexed, I rotate and side bend. And you really got to be up against the patient because you're using your body against theirs to control them. So again, all I have him do is gently try to turn to the right and slightly arch your back a little bit. There you go, perfect there. And relax. And you can come around the back so you can see us treating the exact vertebrae. So a little bit more left rotation, a little bit more left side bending, and then turn to the right and slightly go up. 3, 2, and relax. Turn, side bending, and turn to the right. And relax. Final stretch, back to neutral. So that's how we treat an extended vertebrae with thoracic muscle energy. The next one we're going to do is treating a flexed vertebrae. All right, so this is on page 272. Let's say we have a T4 that's flexed, side bent right, rotated right. So we're up here now. And if it's flexed right, we're going to do the same thing, arms hugging, but this time his head is resting on his arms because I'm going to actually cradle under his arms. So what we do is we actually create our extension here. Remember, if he's flexed, our barrier is extension. How do I create extension? It's by introducing a force going this way towards the anterior plane of his body using my monitoring fingers. So it's pushing that way while lifting his arms. So it's kind of like this, okay? So let's see that again. So if you want to come right to the side, you can see this happening, right, in real time. So T4 is now extended, okay? So we set up his extension barrier. If he's right, I bring him slightly left and slightly left and side bending too. So rotating and side bending him to the left. And then I say, turn to the right, 3, 2, 1, and relax. A little bit more extension, side bending left, relax, good, and rotating left. Turn to the right, 3, 2, and relax. A little more extension, side bending, rotation. Turn once more, 3, 2, and relax. Final stretch, back down, okay? Now, that is treating flexion, I would say below, T1 down. And we're gonna use the head next as our last technique, page 270, to treat the upper thoracics in either extension or neutral dysfunctions. Now, why wouldn't we want to treat flexion dysfunctions with the head? Because if we're treating flexion dysfunctions, we would have to extend the head backwards. And oftentimes when we do that, that compresses a lot of the nerves as well as the blood vessels in the cervical spine, and it doesn't feel that comfortable either. So again, T1 to 4 extended dysfunctions can be treated with the head or neutral dysfunctions, but we're going to go with the book and treat a T4 extended side bent right, rotated right. So it's the same one we just treated, except we're going to be treating with the head this time, and it's pretty straightforward. So if we bring the head into flexion, capturing that flexion barrier, we're flexing down to this level, and I can feel that with my fingers here. We're capturing this top segment above T5. And if he's right, I want to bring him left. So slight left rotation and side bending. And then I tap right here and say, bring your head this way. 3, 2, 1, and relax. A little more flexion, side bending, and rotation. Bring it back. 3, 2, 1, and relax. Once more. And relax. And then final stretch. And then back to neutral. And then we reassess just like how we diagnosed. Okay? And I think that's it. Right? All right. Thanks, guys. That is it.